Welcome to Peterborough Dental Hub.
The truth is, nobody likes going to the dentist, but if you have to, you should go to a good one. And I think the Hub really is very good.
My name is Marcus and I'm a dentist. I run some of the busiest practices in the country. It all started here in Milton Keynes, but today we have practices in Cambridge, Peterborough, High Wycombe and Northampton. I now work as part of the group my mum and dad set up so many years ago here in Milton Keynes. This is a proper family business.
I've been a dentist for almost 40 years, and the one thing I realise is that you've got to meet the patient's needs, their expectations and their lifestyle. People do not want to wait, they want to be treated fairly, professionally and properly. We have a very large team of dentists here. Dentists, hygienists, therapists, dental nurses and receptionists.
I'm Elise. I'm a general dentist working here at Peterborough Dental Hub. I do a mixture of emergency appointments, general checkups, and I also focus mainly in doing complex dental extractions, wisdom teeth extractions. I graduated at Manchester University, so I'm now currently midway through doing a master's in oral surgery. I like to approach patient how I would like to be approached, so try and keep it as friendly as possible, try to make it less of a nerve-wracking experience. It's no one's favourite place to come to, and then I just like to think I treat patients how I would treat my family.
Our patients know that they can rely on us. We offer state-of-the-art care 7 days a week, and we answer the phones 24/7. So no matter the problem a patient has, we will be there to help them.
These are patients who go to other dental practices but come to see us when their dentists are shut or their dentists are on holiday or just simply not available.
Because I had a bit of a problem that could be resolved by my other dentist, I phoned their 24-hour emergency hotline, and it was like 10 o'clock on a Friday night. And they dealt with it. They were very professional, they were there, they were open. And of course, when I found the place, I just thought, well, yep, this is where I need to be coming.
My name's Jazz. I'm one of the general dentists here at the Hub, and I've got advanced training in periodontics and oral surgery. So periodontic disease, also more commonly known as gum disease, is an inflammatory condition of the gums, which can have serious consequences if left untreated. My job is to diagnose and make sure that it's identified early as possible to provide specialised care and to prevent tooth loss. I like working at the Hub because of my colleagues. We're all friends here, and it allows me to collaborate with an extensively trained team who I can rely on 7 days a week. I don't have any hesitations in asking for their opinions and working with them closely to bring about the best patient care.
The fact that you can have a second opinion in-house is really, really important to patients.
I've been coming here for 8 years now, and initially David was my dentist, but I've also worked with some of the other dentists in here because I've had a couple of other problems. So this dentist is very good because they have dentists who've got specialist interests, which means that when another problem was found, I was referred to someone who dealt with that, which suited me fine.
We design all of our practices to make sure that they're friendly and welcoming, because we know how important that is to our patients.
The first thing I ask myself is this sort of person I want to have greeting patients and treating patients? Is this the sort of person that patients are going to warm to?
I think this is such a great practice. The range of treatments is phenomenal, and there's always time to have a chat. So I like that. You get a feeling of sort of warmth. Yeah, warmth.
I'm Cordia. I practice dentistry for more than 20 years already. I graduated from the University of Hong Kong in the year 2000. And I get my first degree in Bachelor of Dental Surgery there. Afterwards, I took many courses like the diploma, advanced diploma, postgraduate diploma, because I have the interest in orthodontics. The kind of patient coming to see me are those who look for straightening their teeth or having a better smile. So most of them looking for orthodontic treatment or Invisalign treatment. Invisalign treatment, like they are removable appliance for orthodontics, clear aligners that are moving the teeth in sequence. So we plan it digitally. We use computer simulation, we use CleanCheck, we use everything to have the records from the patients, and then we plan all the teeth movement with our knowledge, with our technology to manufacture a series of clear aligners. The kind of patients that are suitable for Invisalign treatment are those who don't want braces, they don't want metal or wires in the mouth. People who need to work with people, talking to customers, they don't want to have more visible, the most visible braces in their mouth. Then they want to have those clear aligners to straighten the teeth.
My name is Camille. I'm one of the general dentists with a special interest in oral surgery here at the Peterborough Dental Hub. I feel like I'm quite an open person, so I like to, listen to patients and really make them feel at ease. I like doing a lot of the complex sort of surgical procedures, like wisdom teeth, surgical extractions. So I've had experience of working in the hospital. I like being in practice to be able to, use those skills that I've developed in hospital. So I really enjoy working at the Peterborough Dental Hub. Reason being, we have state-of-the-art facilities, digital scanners, CBCT machines, all the equipment you can need, and also we're right on the riverfront, overlooking the cathedral, which is a really great place to be working.
I think that almost every patient is anxious when they come to the dentist. I think even dentists themselves, when they go to the dentist, are anxious. And I think that's a perfectly normal and natural thing.
I've been coming here, since I was born. I've always been, when I've come here, felt at ease. They've always made me feel relaxed, always explained everything, and they're all really friendly people.
We offer sedation in the practice. We work with a sedationist. That's an outpatient procedure, so involves giving some medication in which changes their state of mind. And the good part of sedation, most of the patients do not tend to remember the procedure. They just need to bring someone in here because we cannot send them out. They're going to be able to walk on their own, but feeling a little drowsy, a little confused, but should be okay.
A lot of people think modern technology is actually very expensive. It's actually not. Most of our investment has allowed us to keep our prices really, really affordable. For example, we can now make crowns in 2 hours for patients that previously would have taken a month.
I am Gulil Al-Azhar. I'm basically a restorative dentist with a special interest in cosmetic dentistry, and I do same-day crowns, which means we do CEREC restorations here. This machine on my right is what I'm talking about. So it's a same-day crowns made out of porcelain. So patient walks in, which happens quite often with us. We are emergency dentists. Patient walks in covering their mouth with a hand because they had a trauma, front teeth broken. They walk out with a smile because we've provided them with a crown, a porcelain crown, same day.
Cross-infection control is of paramount importance to the success and safety of every dental practice. It's not just about protecting the patient, it's actually about protecting the dentists themselves and also the whole clinical team. And actually, a practice that practices the highest levels of infection control is the sort of place where I personally would like to receive my treatment, and where I would like my family to receive their treatment.
One of my jobs running the practice is of course to make patients happy and to make sure we're offering gold standard treatment, but it's also to attract the best dentists, and the best dentists want to work in state-of-the-art practices, in practices like ours.